I'd say let's roll it. Thumbs up. Good. All right. Hello, everyone. My name is Mike Larson. I am an executive healthcare strategist here at CDW. I want to wish you happy holidays. Thank you for joining our webinar on enhancing the patient experience. Pleased to be joined by our partners, Amazon Connect, as well as SpinSci. Thank you, Scat, for advancing the slide to the agenda. So we'll briefly look at the agenda. I've got the welcome and introductions out of the way. I'm going to provide a brief background on CDW Healthcare, a couple minutes on our evolution as an organization. I'm going to throw the baton over to Ken, and Ken is going to talk a little bit about the digital patient journey and the Amazon Connect platform. Then we're going to have SpinSci, our friends at SpinSci, talk about their middleware and how they are working with the major EMR vendors. We will wrap up our time with demonstrations of both products, including the Amazon Connect platform, as well as SpinSci. We have reserved 10 minutes at the end of our presentation for Q&A. We ask that you start to populate your questions during the presentation. We'll see if we can get to those questions in mid-flight. And with that, Scott, I'll have you advance. Let's talk a little bit about CDW Healthcare. So earlier this month in December, we as a company, CDW, celebrated 40 years as a technology solutions provider across multiple verticals. So think about government, higher education, corporate, small business, et cetera. But I think I'm most proud of the progress that we've made in the healthcare sector, and I'll tell you why in a moment. But let's start with where we were 5 or 10 years ago. We were obviously working with a number of healthcare organizations across the country, but we were in largely a procurement or commodity and services role. And over the last 5 years, we have evolved into a true solution integrator. We've done this by expanding our partnerships, expanding our business lines, and through strategic acquisition. We've also done that by expanding our healthcare acumen in the form of resources. Some of the key benefits of working with CDW as your systems integrator in healthcare is our experiences. So we have over 6,500 unique healthcare organizations that we work with across the country of different shapes and sizes. We work with academic medical centers. We work with integrated delivery networks. We work with small community hospitals. So by virtue of our customer experiences, we've seen a lot of innovation. We've seen things that work. We've seen things that don't work. And we're really prepared to share those experiences with the broader healthcare environment. In terms of our transformation centers, this is something I'm very proud of. We have 5 transformation centers in partnership with several customers in which we are defining the business problems in healthcare. We're working on those in collaboration with our strategic partners like Amazon, like SpinSci, and we are building solutions that are purpose-built for the healthcare problems that we are seeing in the environment. Finally, on the right-hand side, you see that we have a number of skilled resources. So 300 dedicated client executives focused completely on healthcare, 20 industry strategists such as myself, former executives in healthcare that have multiple decades of experience across cloud, cybersecurity, and communications disciplines. And then probably most importantly, and Scott and Joel will appreciate this, we have 100 dedicated solution architects. So these are individuals that are focused on developing solutions across the continuum of care. So today you're going to hear a lot about our digital front door strategy and how we partner with Amazon Connect and SpinSci, and I'm excited to hear along with you. So with that, I would like to pivot to Ken Doherty with AWS, Amazon Connect, and allow him to talk a little bit about the patient journey.
All right, thanks, Mike. So, Ken Doherty, CXC specialist. So I focus on healthcare here in the States. I get a chance to share with you Amazon Connect as a digital platform for healthcare that spans all departments. So let's go ahead and go through the slides here, Scott. So I got one history slide here. So 18 years ago, we started developing the DNA core product, Amazon Connect for our retail business. So started back in 2006 and then launched the product in 2017 as a product that customers could consume. What was kind of a wow factor or unique back in 2017, it included natively the engine that drives Alexa as part of the solution. While that's maybe not as a wow factor today, because there's a lot of buzz around Gen AI and the capabilities there. There's last search over 67,000 new Gen AI companies have launched in the last 24 months. Nearly 7 years ago, it was a unique and still today, right, as a product and as a native solution for IVR and self-service. It's a 10-year billion-dollar investment from AWS and is natively part of the product set. The other unique thing with all those Gen AI focused companies, if you go back and you look at the machine learning capabilities and all the services and time spent in developing that Alexa engine, we've been delivering the core AI services for over 20 years as a company. So we think, customers, if you've got a Gen AI or an AI workload and you're looking at how do we take advantage of AI services? We think we're pretty good at it, and you should consider AWS and just part of the that core DNA that we go back to and have leveraged for so long. All right, Scott, let's go ahead to next slide. So when we talk about delivering a patient digital journey, really Connect as a digital platform, a lot of our customers, healthcare customers, focus on the left-hand side of the slide. So they'll have a contact center requirement. They'll want to focus on that digital front door. And I've bulleted some items here that Gartner says are important, right? They've reached out to customers, and it's not a complete list, but it's some top features and services. But in that design, a lot of our healthcare customers build siloed contact center solutions that are staffed by agents, and there's really no way to pass information or share data with the other large groups that engage with patients, and those are in patient access centers. Interesting that when we communicate or we chat with healthcare customers, those caregivers that are staffing those patient access centers have really a very similar set of requirements in terms of use of technology and how can those services help reduce things like average handle time or provide agent or caregiver assist. A great example of that I've put in here is that we have a product called HealthScribe. So this is an AI service that will translate, different than transcribe, right? It'll translate the conversation into the correct medical terms that the doctors and nurses want to put in the patient's record. So in the back end EHR. So a very time saving tool. We've got healthcare customers that tell us that some of their nursing staff take up to 5 to 10 minutes in a wrap up to manually update those patients' records. So using an AI service called HealthScribe to do that manually or move away from the manual updates is a big time savings. So our vision of Connect, it really spans. It's using the same platform across all contact centers, departments, and clinics, and really providing that common digital experience. Go ahead and move on, Scott. Okay, so what does that? Let's go ahead and build this out. So what's that look like in the environment? We would front end the IVR today with that Alexa engine, and let's keep it simple. Let's welcome that patient to your healthcare, and then just simply ask, how can we help you today? Right. A lot of IVRs today give the patient options of press one for this department, two, three. Right, can give up to 10 options, and then when you get into that department, it gives you more options. Right, so it really relies on the patient having to know where they should be, where they should go, and we want to flip that around. Healthcare customers know their environment better than the patient does, so let's just ask why they're calling and then route the call based on that. Sometimes we can collect additional information in the IVR, and we've got an example. We're going to show that for you today, and then screen pop that information for that agent or caregiver on why the patient is calling, and then use the same engine, the Lex engine, to deliver self-service solutions, and these can be used across all channels. So while we're showcasing a voice channel here today, it could be web chat, SMS, email. So there's a number of options that you could use within the Lex engine to deliver self-service capabilities. Great examples would be, I need the address for my outpatient visit today, or I'm driving and I want to stop by. Is my prescription ready? And what hours does the pharmacy close? Right. We think there's a lot of uh, um, requests that come in from patients that don't need a live agent. Right. So how can we use that Alexa type experience to deliver that information timely, and keep that call from having to wait for, in queue for the next available agent or caregiver? Interesting when we talk to healthcare customers and the routing of those calls. 10 to 20% of calls land in a contact center supported by agents, and then a bulk of the calls still go to those patient access centers that are manned by caregivers. So today, those are manually. Those calls are taken over. Either a PBX type experience. So the caregiver will pick up that phone, and have a direct dialogue with that patient, and manually log into the different platforms. And we're suggesting that, hey, let's look at an experience that we can use a common platform across all departments that engage with the patient. Let's go ahead and move on, Scott. So little, reality is, when we're probably all said and done, it includes both that contact center, patient access centers, but we can also include internal HR, IT service desk type groups. We also have a pretty large portfolio of products around digital outreach. So the automation of care, monitoring of IoT devices, reminders, patient reminders to, monitor those IoT devices, and then remind patients to take a look at something, or maybe take, medication. Appointment reminders. 40% of, or a large portion, the number one reason why patients don't no show for appointments is just too hard to change it. So let's create an environment where it's easy, right? That Alexa engine as a again, to be used as a digital outreach to check in with patients, make sure they're going to show up for the appointment, and then maybe offer options if it's not going to work out for them. Very similar service for referral scheduling. 40% of referrals go unfilled. So how can we use that Lex engine to reach out to those patients, and try to get them scheduled for an appointment? That's a lot of, that's the, lost revenue for healthcare. So let's, again, take advantage of that platform. And really, at the end of the day, we're trying to deliver that digital outreach to lower that readministration rates, and help lower, operating costs for healthcare. But I do want to shout out, while it's not part of the Connect portfolio, we've got a group that I work with here at AWS called the Alexa Smart Properties. I would encourage you to take a look at that group. They focus on in-room, so in-room and at-home care through the using the Alexa devices. So, a pretty interesting group, and it'd be great to tie in those digital outreach and notifications through those Alexa devices. Let's go ahead and move on, Scott. Okay, so how is it that AWS can deliver this? We have when we meet with healthcare customers, they said, "Wow, this is we've always wanted to build that single digital journey or look at a platform." And the reason why AWS is unique, it's top left there. We invoice on usage, so we don't have any license or contract requirements like other platforms do. Today, if you've got a blend of agents and caregivers that use the platform, we bill by the minute. So if you've got as an example, back to my nurse on call, if that nurse only uses the platform for 4 hours a month, we'll bill you roughly the $7 or $8 that adds up to the usage there. And this would, in other platforms, you're required to get $150, $200 a month license for that individual. So it makes it really, it makes it a challenge to use that, as a way to contract and develop a single solution across all departments. I've already talked about some of the other, the AI omni-channel services. Although I do want to just mention, that Alexa engine Lex. A lot of people know that as a voice-driven platform with the devices at home. It's really can be a combination of any channel that you want to engage with. So I think we're going to demo some of that in the experience here today. But it could be web, it could be SMS. So at the end of the day, that Lex engine has multiple channels for you to engage with, and just recently announced WhatsApp integration as well. So if you've got those requirements, you've got a large population that might be using WhatsApp, we can now support that as well. All right, let's go ahead and move on. Okay, so I'm going to turn this over to Sebastian for the demo piece.
Awesome. So hello everyone, my name is Sebastian Alvarez Vasquez. I'm a solutions architect here at AWS, and I specialize on an engagement platform called Amazon Connect and all the services that surround it, right? I support customers on the healthcare space, helping them transform their experience when it comes to engaging patients across different channels. Today we will see a demo of this fictitious patient. Her name is Joanna Doe. She fell from a ladder a few days ago, and she's seeking advice on what she should do because she's having back pain, after the fall. A few things about Joanna. She would like to have omni-channel interactions with her healthcare provider. And what I mean with this is that sometimes a voice call would work great, but some other times text or web chat or even WhatsApp conversation would be a better option. And something we are seeing, especially with the younger population, is that they are looking to avoid human interactions when possible, right? If I can get some information from a chatbot or from a different source, they would like to avoid the human factor when possible, as I mentioned, right? So on the demo today, we will see that Joanna will visit the GenAI-powered virtual nurse portal. She will interact with this generative AI virtual nurse practitioner about the symptoms that she's facing after the fall. And basically, the GenAI virtual nurse will perform a triage, collecting as much information as possible during that interaction. Once the generative AI virtual nurse collects enough information, it will hand off that interaction to a live nurse. But before doing that, it will summarize the conversation and then hand it off. So once the live nurse picks the interaction, right, she will have a complete summarization of what happened during the interaction there. So with this, what I will do is we will have Joanna jump into this fictitious patient portal. And we will see a chat experience because it's easier to follow from a visual point of view. But as we mentioned earlier, we are a truly omni-channel platform. So all the experience that you are seeing here on web chat can be easily replicated on voice, SMS, WhatsApp channels as well. So what Joanna will do first is she will click on the bottom right bubble that we have on the patient portal. And basically, she will start interacting first with the virtual nurse practitioner, right? The virtual nurse practitioner is introducing itself, and now Joanna can start interacting with her, right? Joanna must type start typing like, I'm not feeling well. I fell from a ladder 3 days ago, and now my back hurts, right? And now the generative AI virtual nurse will start interacting with Joanna, collecting as much information as she can about her symptoms, the pain level, right? In this case, it's asking me where exactly my back is hurting, right? In this case, I'm gonna say lower back, and then it will continue the conversation, right? It will basically ask, in this case, exact location. Is it the right size on the center? I'll say it's on the center of the lower back, right? And then, as I say, it's continue asking all the questions that a real nurse will ask during a triage process, right? Is the pain worse with certain movements or positions, right? In this case, I will say yes. And then, does remain does the pain get worse or remains the same when you move them? I will say something like, it gets worse when I sit for long periods, right? And as you can tell, the interaction can continue, right? We want to collect as much information as possible when interacting with the nurse or with the GenAI powered nurse, right? I'll answer one or two more questions just to get more context when we hand off the interaction to a live nurse. In this case, does the pain radiate to your legs, or I will say now here, right? And let's assume in this case that the triage has been going for like 5 to 10 minutes, collecting as much information as I said. And in this case, let's break the interaction with the virtual nurse and let's connect the interaction now with a live nurse, right? So in this case, I will say, can I talk to a nurse? Right? And what the virtual agent is doing now is summarizing the entire interaction, looking for the next nurse that is available, right? And will hand off the interaction to her. So this is the UI or the workspace where the nurse will be basically handling all the interaction. If it's a voice call, if it's a chat, if it's an SMS, the same UI will be for her. This channel will be only different. As you can tell now, I'm on an offline status. If I go to available, the chat from Joanna, in this case, comes to me. As soon as I accept the chat, right, basically she can get a full transcription of the entire interaction with the virtual agent, right? And what we are presenting here to the nurse is basically an extra conversation transcript in case this was a voice call, but also it's a summary of a conversation with AI, right? Describing all the details about the conversation on a summarization way, right? And it's also providing next best action to the nurse only, right? We don't want the Gen AI nurse to provide any recommendations to the patient, but it can give advice to the nurse saying, based on the symptoms, I will recommend A, B, or C, right? So in this case, the nurse can take action, can basically help Joanna. And we also have what we call Amazon Q and Connect here on the right side of the screen, where basically it will connect to your procedure repository or a knowledge-based repository and basically assist the nurse during the interaction. In this case, let's have an example that, I don't know, the nurse is recommending sumatriptan for Joanna for the pain. I know it's not the exact use case, but Joanna wants to know what are the side effects of the medication, right? The nurse can ask, like, what are side effects of sumatriptan, right? And as I say, it will connect to your knowledge-based repository or your procedures repository, and it's going to generate an answer based on the information that you trained the virtual agent on. This was the demo we wanted to show you. Thank you for watching. Scott, back to you now.
All right, I'm going to go ahead and introduce Ashman, the CRO for SpinSci.
Hey, everyone. Thanks for having me. Excited to be here. Really, what I want to now do is take it home in terms of Sebastian showing the self-service workflows, and I'm going to show some of the full-service workflows and how that escalates into a live assistance with a live nurse. Before I jump into that, we have 4 different product lines that we've built out with CDW and Amazon Connect as we interoperate into the key market EHRs like an Epic, Cerner, Athena, Meditech, eClinicalWorks, and NextGen. The four products are Patient Engage. Patient Engage, think of it as a virtual assistant that's highly skilled on a AI engine like Amazon Lex, and it's able to drive many different workflows from automated scheduling to self-service billing to refilling my prescriptions, all the way to what you saw in terms of symptom analysis that Sebastian showed. We also have the ability of escalating that to a live advocate. So it's not just the self-service piece, but it's also the full service piece as well. And as you go into an access center from a nurse triage standpoint, we want to be able to push all those details at their fingertips. And so that's where Patient Assist comes in. It significantly reduces the call handle time that we're seeing across the access center advocates from scheduling to billing to pharmacy to nurse triage as well. We've scaled this to Notify. And with Notify, one of the things that we've done is we've now allowed us to interoperate with Amazon Pinpoint, and we can drive real-time access reminders from appointment reminders to orders and referrals to pharmacy RX reminders, all the way into bill pay reminders and even welcome messages as patients are newly registered within your EHR. And then the last piece is compliance. One of the things that we've done is we've created a PCI trust zone natively inside of the EHRs. It's called Swipe and Save, and it really optimizes the rev collections within your patient financial services team. But today I'm just going to continue the workflow as we continue from self-service to full service. Scott, do you have a next slide? Again, here are some metrics that I've already kind of touched on. Engage, we're focused on containment and self-service containment. Assist, we're focused on driving the call handle time down across the different skill types in your access center, whether it's on scheduling, billing, pharmacy, referrals, orders, or triage. Reminders, we're focused on two outputs. One is how do we reduce the no-shows on the appointment reminder side? The second piece is how do we reduce the leakage on the orders and referral side? We're all patients here today, and we all have very busy schedules, and we want to be able to remind patients of upcoming schedulable orders or imaging reminders or referrals, because that's revenue that's definitely captured from a health system standpoint. And then lastly, on the patient comply side, we've really, really worked with Amazon Connect and CDW on how we can really optimize, still in a PCI compliant way, your rev collections, both pre-appointment and post-appointment as well. Scott, next slide. Here's just a quick high-level architecture overview. Again, you have the Agenta server, which is really the orchestration framework. You got the EHR on the bottom right-hand corner. So that is your Epic, Cerner, Athena, Meditech, eClinicalWorks. We now have a CRM space, and a lot of health systems are looking at what does healthcare look like from a marketing perspective. So before the patient has reached an encounter in the EHR to post-encounter, how do we really drive that conversion rate in a very highly efficacy way? And so we're looking at different CRMs like a Salesforce or Dynamics or Epic Cheers from that perspective. And then these are the different four products that are there. Notify's outbound strategy, Engage's inbound self-service strategy, and Assist is the full service desktop integration, which glues the holistic view of inbound and outbound together.
And then Ash, while we're on this slide right here, I believe I saw a question pop up from Eddie that was asking about, Ebby, that was asking about if, Amazon can interface into Epic MyChart portal. So I think this might be a good slide to kind of talk about that integration and how you can kind of help Amazon to pull that information out that's needed.
Absolutely. Yeah. And so MyChart is really a different medium that's out there. Think of it as, mobile strategy. one of the things that we're looking at with Amazon Connect is being able to not only do voice bots and chat bots, but also do what we call a visual IVR and a visual IVA. And so that's where Sebastian touched on it. You can start in a voice type of framework, and then you can deep link yourself into the specific mobile applications that are out there. It could be MyChart, it could be a homegrown application, but we want to be able to drive the adoption of MyChart up. Pre-COVID, what we've seen is about a 30% adoption and about a 12% usage rate across a lot of the different health systems. Post-COVID, we're seeing around a 52% adoption rate and a 28% usage rate across the different health systems. And what we're seeing with MyChart is brand equity across a lot of the different health systems. So the higher we can drive adoption through the phone channel and through the chat channel and really parlay a very balanced, integrated approach is really what Amazon Connect's approach is.
Thank you.
Of course, it's a good question. Here are a couple live case studies that we do have with CDW and Amazon Connect. I'll start with a large health system out of Michigan, Northeast. We're driving pharmacy automation. We've scaled this across 68 hospital pharmacy sites. They're moving from Cerner to Epic in terms of Epic Willow Ambulatory. And right when we deployed the pharmacy workflow, we're seeing 22 seconds saved across all the different medical assistants, the PSRs, and the telepharmacists that are processing these refill requests that are there. We're averaging about 168,000 self-service requests per month, and we're seeing about 71.4% containment rate on the prescription refill side. We have another health system in the Northeast as well. That was really our first health system that we went live with. It was actually Nurse Triage, which is very close to this use case. They invested in contact center. They also invested in Epic, and they're creating a nurse on call team. And one of the key things that they wanted to do was they wanted to pop context to the nurse on call team so that they don't have to go through a click to burn fatigue across a lot of the different activities that are inside of that EHR. And so we were able to provide that context. We worked with their EHR teams. This was about 9 years back, and we saved 43 seconds per call, which is giving their nurses quite a bit of time back in their day. Another Southeast health system, the Green Box. One of the things that we are really focused on with that health system is they have a large work queue of orders really on the MRI side and on the imaging side that they're trying to convert to actual appointments. And so we were able to, based off of our integration into Amazon Connect and driving the outreach campaigns, but because it was integrated into the rules of their EHR, we were able to increase their conversion of orders to appointments by 28%. So that was a big revenue savings as well. And then lastly, a Northwest health system. This is really exciting. It started with COVID vaccine visit types, and we've scaled very rapidly into imaging visit types, into primary care visit types, into open scheduling, which is basically net new patients, and direct scheduling, which is existing patients. And we were able to follow 98% of their decision trees and be able to automate it via a voice bot and a chat bot. So it's all thanks to Amazon Connect, which is the backbone, and CDW, which is a really good channel of really driving the business requirements. But the platform itself has the ability of being very flexible and scalable across the access center, from triage to scheduling to billing to orders.
All right. Now, if you want to grab the control of the screen, Ash, we'll go ahead and let you do the demo.
Absolutely. So I went ahead and I'm going to continue on with what Sebastian was driving. One of the cool things that Amazon Connect and SpinSci have done is we basically integrated the full patient assist dashboard with CDW inside of here. And so this is connected to every single EHR that you might have, an Epic, a Cerner, a Athena, a Meditech, a eClinicalWorks. But right when I brought in a call, I'm able to now see if it's a single match, multi-match, no match, or mismatch. Now, you saw that Sebastian was able to already authenticate in a virtual assistant driven by Lex. If I were to escalate that to a live agent, I don't have to pick from any of the different patients that are associated with that phone number. I basically already know that this patient has already been pre-authenticated and they're ready to continue that workflow. We're also able to see any active problems or active allergies that were either mentioned in the virtual assistant or the LexBot, but we're also able to pull that from the EHR source in real time as well. We have a nice calling destination card. So one of the things that we've really worked on with many of the different health systems is we know that there are many different phone numbers that are connected to many different clinics that are connected to many different departments that are there. And we want to provide a very simple, easy way for users to navigate hours of operation across the different clinics and even into how do you schedule for specific providers of that specific clinic that's there. We have a full notes history. This is really cool because you can now see from the virtual assistant what actually got saved into the EHR and what was the patient to virtual assistant conversation that happened. You also have the ability of adding a drop-down note as well, and it has the ability of memorializing into the EHR or the CRM that's there. This is the patient 360-degree view. So now we kind of are scrolling into what are the different appointment trends, the referral trends, the billing information team. We can even see a nice little map geolocation of the patient geolocation. And then we can see, okay, here are some of the pharmacies that are around that patient. Here's the preferred pharmacy that's around that patient. This is the calling destination that's there. We're also popping insurance details. So one of the things that we're looking at is what does real-time eligibility look like as we're scheduling an appointment? So we can do an RTE integration in real time just to understand, is this insurance current? Is it eligible? And is it their active insurance today? Continuing on with the nurse triage tab, this is a quick drill down view if I was a nurse on call of all the active problems, the medical history, and the active allergies that might be associated with that patient. If I wanted to quickly navigate into the EHR, I have the ability of navigating very quickly into the EHR. So I could see the appointment activity, or I could see a refill encounter, or I could see demographics, or I could see a snapshot view of that specific patient in the EHR. Again, really trying to consolidate on the number of steps that we're trying to navigate with the EHR that's there. Here's a quick view of the drill down view of appointment trends. And so I could see past trends, future trends, cancel, no shows. I can have a quick button into my EHR to launch into the appointment context inside of that EHR that's there. If I wanted to go ahead and cancel an appointment, I can go ahead and cancel an appointment and we can update the EHR in real time, or I can confirm and we can update the appointment in real time or edit any notes that are associated with that appointment. We talked about referrals and how we can convert referrals into actual appointments in a very efficient way. And so this is not just an inbound view, but it's also an outbound view as well, where I could see any of the different referrals that are associated with that specific patient. We talked about billing. You know, we have a PCI trust zone, which is basically integrated into your Epic or Cerner or Athena or Meditech type EHR that's there. And the beauty behind that is it has the ability of conferencing in a AWS LexBot to secure pay that application, whether it's a professional bill or a hospital bill that's there. And lastly, we talked about prescription refills. And so you could see the full adherence view of the different prescription refills associated with Joanna Doe. And so you could, submit a refill request into a specific queue for a medical assistant to look at that refill request and see if it, needs a follow-up appointment with the prescribing provider, or we can submit it based off of the classification of the drug. Scott, I want to hand it back off to you, but that's the full 360-degree view of Joanna Doe and what happens when it does get translated into a live assistant.
Absolutely. Thank you, Ash. And if anyone has any questions, remember just to go ahead and throw them in the chat, and we're happy to pull up the demo again or showcase any of the information we've kind of gone through or dive into deeper detail. To kind of wrap things up for today, I'm a patient experience architect with CDW, Scott Merritt. And in my role, I know you saw at the beginning that we have 6,500 different healthcare systems. I cover about half of the country, and I haven't talked to 3,250 of those customers yet this year, but I do get to talk to quite a few of them, which means that I get to kind of see what everyone's thinking, kind of what the trends are in healthcare. And I've compiled those into this particular slide. And the idea behind it is, every system wants to see what the other systems are doing, what they're taking advantage of, and then kind of share that knowledge to enable a better customer, a better patient outcome kind of across the spectrum around that continuum of care. The three big things that I see or hear in every conversation kind of boil down to three different topics. They're around consumerization, standardization, and obviously the cloud. Lots of people are interested in the cloud. From a consumerization perspective, what that is patients now have access to different ways to go get care. So, your traditional brick and mortar healthcare systems are a lot more interested in, how do I differentiate myself? How do I market our capabilities? How do I increase brand loyalty, and kind of be sticky with the patients? And a big part of that is the things that we covered today. Being able to use these different digital channels to make it easy for your patients to access your services, make it easy for them to reschedule. As you're doing that, as you're making it easier for them to access, you're also making things more affordable. By doing things like decreasing the no-show rate. I think there's something like $150 billion a year spent on patients not showing up for appointments. So just being able to decrease that no-show rate, like Ash was mentioning in his statistics, is a huge win for the healthcare system. Making things more affordable by leveraging different channels. It's a lot easier to utilize a bot to schedule a meeting. It's a lot more affordable than having that same call route to an agent. You're talking the difference of 15 cents versus $15 when you start getting agents involved versus using these different digital channels. And then from a branding perspective, personalizing the experience, being able to immediately pull up that, yes, hey, you're Scott Merritt. You just called. That's really cool. I see you have an appointment coming up next Tuesday at 3 p.m. Would you like to confirm that appointment, cancel that appointment? Oh, I'm good for that appointment. Oh, then what else could you be calling? Oh, we see that you owe $1,000. Would you like to pay your bill? So making it so that the bot, the voice bot, chat bot, is able to see who's coming in, understand what they're probably trying to call in about, and then help them get that issue solved quickly, and then also allow them to go to an agent if needed. You can escalate the call, escalate the chat to an agent, and then we escalate that interaction to an agent, being able to provide that agent with the context to quickly take care of that patient's issue. That's also going to make the conversations more affordable. It's going to enhance both your agent experience as well as that patient experience. So kind of a win-win on that one. And then just really briefly, I think a lot of us have been involved in standardization conversations in healthcare for probably the last, I don't know, however long you've been in healthcare. I know from my personal experience, standardization has been a thing for decades. And a lot of that is due to the merger and acquisition kind of aspect of large healthcare systems, as well as, you got different departments that run out and buy point solutions to handle individual things versus kind of looking at the entire picture like an IT department would need to. Now with AI, you have a better story to kind of preach the standardization to the end users, because as you get that standard database, as you get those standard interactions lined up, you can leverage AI easier and better to be able to provide a better patient experience. The first conversation you're going to have when you start looking at doing self-service is, okay, cool. What does your database look like? What kind of EHR system do you have? It's really about the data. Cloud, I know a lot of healthcare systems initially averse to migrating different critical applications to the cloud. But now as people are starting more and more to put EHR systems in the cloud, Obviously, COVID showcased the fact that putting your contact center in the cloud allows for a lot more scalability versus the systems that were getting overrun with phone calls there during the pandemic. Also, from a compliance perspective, one thing that's kind of a niche issue for healthcare systems is that you can't send patients home for the weekend so that you can do an upgrade on the phone system. So by having the systems in the cloud, it does provide for that ability to stay current, which avoids compliance issues, those sorts of things, as well as allowing you access to the latest AI features and capabilities. Again, if you guys have any questions, feel free to throw those in the chat, and we'll kind of keep going here. We do have the last 10 minutes reserved for coming off mute and asking any questions you'd like to ask. But one of the big ones that we hear a lot of is, how do I get started? And I mentioned I get to talk to a lot of our customers around the country. And one of the things that I do, which is a CDW funded workshop, it's called a patient experience workshop. And that's where we kind of bridge the gap with the IT department and the clinical teams, the patient access centers, your scheduling departments, rev site, all these different people, the operators, and kind of sit down and just kind of work through what the current use cases are, what's currently happening in the contact center. And then from there, utilizing, the knowledge I've gained by doing all these different workshops with multiple systems, we're able to make some recommendations, either this system is one that you should continue with and it's working great for you guys, or maybe you need to look at a different system, or if the questions, should I go to the cloud? We can make some recommendations based around that, if it makes sense or not. So it's a workshop that kind of gives you a way to kind of lean in and start looking at different ways that you can take advantage of the new technologies out there. We also have 2 different workshops that are at a higher level that are a lot more effort involved. And these are our minimum viable agent workshop and our strategic consulting engagement workshop. And just real briefly, the difference between those is that strategic consulting engagement takes a really deep dive and looks at all of your stakeholders and kind of comes out with what's going to be your ROI of investing in a new system. What are the advantages of investing in a new system? What are my best use cases to achieve the optimum results from leveraging AI? And then what that MVA workshop, the minimally viable agent workshop, does, it kind of adds on to that strategic consulting engagement workshop by, at the end of it, the deliverable being an actual use case being solved with a bot that's developed and put into production for you guys to use. So like, let's say the use case that comes out of it is scheduling, actually putting in a bot or a chat bot or web chat, however it ends up being, to actually take care of that particular issue. So that's kind of the difference between those. And then let me build this slide out quickly. CDW itself, obviously we've been doing this for quite a while. We've got over 2 decades of contact center experience, a large engineering team that's very used to working with AWS, and happy to help in any way possible. And now what I would love to do is see if there are any questions. Please put those in the chat and we can go ahead and get those addressed. And then, like we mentioned earlier, if you do have any questions or want to reach out later, feel free to do that as well. But let me go ahead and stop sharing. And I can go over here to the chat and just see if we have anything. All right, Mr. Larson, we've got a question in here about the innovation centers. Are they open to public access, or how does that work, or what's the process for a visit?
Yeah, so as I mentioned, we work with customers on setting up visits to our transformation centers. Thanks for the question, Alex. There have been circumstances where a customer has requested that a partner like AWS participate. And so just to answer your question, you kind of have to work with that shared customer to set up that visit and the content and the agenda. It will be limited to what the partner is working on. So if the partner like AWS is building out maybe a digital front door strategy, that would be probably the limit of that engagement, just being transparent with you. But hopefully that answers your question.
Awesome. Thanks, Mike. Are there any other questions? If not, oh, here we go. On workshops, do we have one? Thank you, Evie. I see it in there. On workshops, do we have one for clinician and one for IT staff, or can we have a combined workshop for both groups? For the workshops, Evie, what typically happens is we do combine the two. The process, depending on the type of workshop, normally starts out with a technology roadmap session with the IT group. That's where we come in and understand what your current applications are, what the dependencies are on different databases, EHR systems, all of that. We kind of get a good understanding of what the IT infrastructure layer looks like. And then for the next phase of the workshops, we bring in the actual clinical users. So in that case, you'd have your patient access center come in, your schedule, the different groups that make up the ones that leverage these digital channels the most. And then normally IT sits in on each session. We have each group come through and do a workshop with them, which is just a facilitated focus group where we get to understand exactly what it is they're doing on a day-to-day basis, all of that. We also spend some time sitting with the agents, watching them, seeing what they do with their screens and all of that. And that's the patient experience workshop that I run, that we'd come up with recommendations, high level, out of that. And then from our strategic consulting engagement workshops, that considers a wide range of stakeholders. So IT would be included, obviously, as well as all the other impacted clinical users would be included in those workshops as well. So we definitely have a combination of the two is the best way to go, I think, because that way you're getting your business reasons, your clinical reasons, what's needed from that perspective to help our patients, as well as, how does the IT part fit in? How is this actually going to work? And making sure that it scales across the entire environment. Thank you for the question. All right. Does anyone else have any further questions you'd like to throw in the chat? And like I said, feel free to reach out afterwards as well. All right. If we are all good, I'd just like to say thank you very much for attending. We appreciate all of your time. Thank you to our presenters. And I hope everyone has an amazing day and has a really great holiday. Thank you.